Okay, that's fine. That's fine. Okay, so hello everyone. So I'm very honored to give a keynote in the Bioethics Education International Winter School. I'm very thankful to Dr. Annalida for the invite. And it's been such a great time planning the winter school and getting to know about the progress and the recruitment of participants. So I'm very excited today to talk on a topic that is it's a rather new research that I recently started. My talk is titled "Recruitment by Algorithm: Bioethical Challenges of Generative AI in Clinical Trials." And I wanted to talk on this issue because trial recruitment is one of the most consequential stages of biomedical research. And it's also one of the most contentious bioethical issues, especially when we consider the diversity of representation in clinical studies. When we look at issues such as the participation of ethnic minorities, global representation, it's a highly contentious issue. So today I want to talk about what happens when decisions about participant selection in clinical trials are becoming increasingly delegated to AI-powered algorithms. And in particular, when we deploy generative AI systems to facilitate recruitment in clinical research. So this talk is based on a co-author study, which I initiated several months ago with Professor Renan Leonel da Silva. He's currently at the New Jersey Institute of Technology. And we decided to explore the ethics of AI-powered patient recruitment in clinical research. And the interest was especially prompted by the development of trial GPT. So this is one of the, I would say, the most influential tools for recruitment, AI tools for recruitment currently being developed. So throughout the talk, I will use trial GPT as a concrete case study to illustrate developments in this field. But my focus is not on the evaluation of a single technology. Rather, in this talk, I aim to highlight some of the broader ethical issues that occur when recruitment becomes algorithmically mediated. And it is a technology that brings a lot of promise, but it is also technology that is highly contested and highly questioned. Okay, and just a quick question, everything is okay? You can see when I'm changing the slides, right?
Yes.
Perfect. So here is the roadmap of my talk. So when I was thinking how to introduce this issue to the participants in the winter school, so I decided to provide contextual information, not just jump directly to discussing the core bioethical challenges. So before I dive in, here is how my talk will unfold. First, I will begin by explaining why recruitment itself is such a deeply ethical practice. Why is it? Why it is not just a technical step in the recruitment process? So I will then look at how AI is reshaping recruitment workflows and what are the expectations and the hope around the introduction of this new technology. So as I already mentioned, trial GPT is my benchmark case, and I have selected this not because it's an exceptional tool, but because it represents a relatively careful and transparent design in comparison to other tools that are currently being developed. So it is a tool that is being developed responsibly, but it's not without its faults, without its ethical fault lines. So I will also briefly highlight the trajectory of this emerging industry. Like, it's a growing market, so you will be surprised to see how much investment is put into developing these AI tools. And the core of my keynote will focus, of course, on the 4 ethical fault lines presented by this new technology. So I will discuss 4 major ethical challenges that have to do with opacity, informed consent, bias inherent in AI algorithms, and also the issue of accountability, which is central to bioethical decision making. So finally, I will discuss some conditions, outline some conditions for responsible use that we have developed in our research. And I will also discuss the relevance to global bioethics, and especially because this is the global bioethical school, and all of the participants bring this diverse global perspective. So I'm hoping to encourage some discussion and some debate. So let me start by I'm sorry. Yeah, just give me a sec because I'm having my own technical issues. Okay. Next slide. Okay. So first of all, like recruitment. Why are we talking so much about recruitment in clinical studies? And the reason is because recruitment has been for a very long time a structural and highly systemic problem in biomedical research. It has often been framed as a technical bottleneck. Something that is very slow, something that is inefficient, something that is very costly. So it is considered a very high structural problem. But from an ethical standpoint, recruitment is also a gatekeeping practice. It's a practice that involves power relations. And it's a practice that has been subjected to significant scrutiny from bioethicists, like prior to the introduction of AI mechanisms into this process. And why it is such a problematic practice? Why it is a gatekeeping practice? First of all, it determines who becomes visible in research. So recruitment really shapes who becomes research subjects. Second, recruitment also determines whose bodies bear risk in this process, and whose experiences ultimately shape medical knowledge. So the reason why clinical recruitment has been subjected to so much scrutiny and criticism is because there has been persistent delays in terms of including diverse populations in clinical research. Marginalized populations have been underrepresented historically. I was speaking a few years ago. I was on a DEI panel on diversity, equity, and inclusion in clinical trials, and several of us deliberated on how we can encourage the participation of visible minorities and how can we increase the diversity of representation. And some colleagues suggested, pay them. Like, it's as easy as this, pay these people to participate in clinical trial. But of course, and this could be a solution, but of course, it is not, there is no one-size-fits-all approach. How do we motivate people for marginalized population to participate in clinical studies? And there are really important historical reasons and power relations and inequalities. They have influenced distrust among some of the marginalized populations. So recruitment generally, and when we say persistent delays, there are persistent delays and chronic representation of marginalized population, which make this not simply a logistical problem. So recruitment is a normative problem. There are normative failures in this field, and these normative failures have had significant ethical consequences. So why AI is being adopted for recruitment, for clinical recruitment? And I probably already answered this question by discussing how inefficient recruitment has been and how difficult it has been in terms of diversity, ensuring diversity of representation. But let me just say a few words about the importance of adopting AI. So against this backdrop, AI is positioned as a solution. So here we have large data set, increasingly complex eligibility criteria, and pressures to accelerate timelines in biomedical research. So all these create strong incentives to automate screening and matching of participants with the respective clinical trials. So AI can provide solution to this pressure to accelerate enrollment. Like that, there's growing effort to include more and more research subjects in clinical studies, and using these automated processes is one way to achieve this. So AI is often framed as neutral optimization, but we should be aware that this is ethically misleading. This is ethically misleading because efficiency is never value neutral, especially in this field of clinical research. So when when the history of experimental therapies show that efficiency is not always the best way to proceed if we want to ensure a responsible development. Okay. Okay, so why generative AI in recruitment? This is one of the key questions here. And in order to understand this, we have to really look at trial GPT and other tools and how complex these new AI technologies are. Basically, generative AI uses large language models, LLMs. These are not simple rule-based systems. These are algorithms that interpret unstructured clinical data, like large data. They infer eligibility, so they have a strong potential for matching. They also generate patient-facing explanations, generate the number of documents that are being used in the clinical recruitment process, including consent documents, which so they are really these tools have really great potential. So the system also operates probabilistically. So they do not apply rules in a transparent. They do not apply rules in a transparent way. So it's not a decision making that you can see in human-led recruitment processes. So the systems use very they're very efficient in terms of time, time and matching possibilities, but they do operate probabilistically, and they can extract information from very large data set. Okay, so what we are witnessing with trial GPT and similar tools being developed is not just an automation of the recruitment process in clinical trials, but it is also a qualitative shift from human judgment as leading recruitment to algorithmic mediation. So it's really a profound transformation in how judgment is being exercised in this bioethical domain. So traditionally, recruitment has relied heavily on the discretion of clinicians. So contextual knowledge has been incredibly important in selecting participants and really matching them to the best possible clinical studies. So this contextual knowledge, which involves judgment by clinicians, by physicians, even primary providers, referring patients. So now this is being replaced with pattern inference, which is how AI operates and how algorithms function. So why is this problematic? And here is the first major problem. We have human accountability, which has been central to clinical trials, that now is being is becoming harder to locate. So we have a responsibility which is distributed across many spaces, across larger databases, so across algorithmic decision-making and presentation. So it is becoming harder to pinpoint some of the major criteria how to hold people participating in the process accountable. Okay, so trial GPT, which is the benchmark case I'm taking for this talk. Why trial GPT? So it has been framed in the literature and the public-facing documents. It has been framed as a decision support tool, not as an autonomous enrollment system. So this is one important distinctions that I have to make. So there is this large debate and conversation around trial GPT that emphasizes that it will support clinical decisions. So it's not an automated enrollment system. So it's not entirely responsible for all decisions in clinical trials. So it is considered comparatively, its design is considered comparatively responsible when we look at other tools that are currently being developed by the industry. And so this system was developed in collaboration it is a collaboration between the National Institutes of Health in the United States, which is the major funder of biomedical research, and also University of Illinois in Urbana-Champaign. They are the major powerhouse between the development of this new tool. So it is function as a criterion level eligibility assessment in the process. Studies have shown that it is highly accurate. So as you can see on the slide, so over 87% reported accuracy, which is a great accomplishment for an AI tool. And once again, you know, like it is discussed, it is marketed as something that supports as a tool that supports decision, not as a tool that is being used for autonomous enrollment, direct autonomous enrollment. So briefly about the timeline. So how Trial GPT has developed from leading research prototype to a policy relevant tool. And you can see how the technology has very quickly matured over the past 2 years. So the research prototype was released in 2023. So it was introduced as an LLM-based patient trial matching tool in early to mid 2024. It received institutional validation from National Institutes of Health. It was included in their Gen AI pilot. Then it received also the Director's Challenge Innovation Award. That's by mid 2024. It showed some signs of acceptance and maturation. So in late 2024, it received full, I would say, full scientific legitimacy through a peer-reviewed publication in Nature Communications, and I will provide you with reference on the next slide. But this is when we got interested, myself and my collaborator. We became interested in this tool, like knowing how contentious the issue of clinical recruitment has been, and you know, the promise associated with the integration of AI tools. And in 2025, it has received full public and policy visibility. There has been some media coverage, pilot discussions, there's some governance interest. So it is being accepted, more widely accepted, like I would say. Like I was, when we started working on the study, I think the first conversation was around March 2025. I had not heard about it. Like it was really in the process of development, but the expectations were that it will become a very significant tool in the clinical research space. And here is, as I promised you, so the article in Nature Communications, which researched the effectiveness of Trial GPT in terms of matching patients to clinical trials. And it's an article that actually established that the algorithm is working quite well, that you know, it has a very high rate of success, like as I mentioned, over 87%. And at this time, a few months after the article was published, so my collaborator and myself also, we started working on exploring the ethical implications of AI in clinical trial recruitment more broadly, but we decided to work on take Trial GPT as a benchmark case. And you can see here on the slide, you can read, so Renan wrote this wonderful article that is published on the website of the Canadian Institute for Genomics and Society It is part of our bioethics blog. So it's a short piece, but it outlines key bioethics principles: fairness, accountability, transparency, that need to be that ought to be incorporated in the development of AI-driven innovations in clinical trials. So I invite you to read it. Just a great summary of the ethical issues. Okay. So a brief look at the industry landscape here, and as I mentioned before, trial GPT is just one of the tools that is being currently developed. There is a rapid global deployment of generative AI to optimize the clinical trial space, and you can see some of the examples here of AI-optimized recruitment tools. And the market forecast is pretty good, I would say. It is expected that this market will reach 5.6 billion by 2028. You can see like a significant global impact. And have in mind that clinical trials are fully globalized, the majority of clinical trials, and most of them are conducted in low and middle income countries nowadays. So it is becoming a global issue. So the core of my thought is the bioethical challenges, and I have identified 4 specific ethical problems that need to be addressed when we develop AI tools in clinical studies recruitment. And the first one is the epistemic opacity of such tools. Like, as I already mentioned earlier in the talk, algorithms do decisions that are highly complex, probabilistic in nature, and they're not transparent in terms of how selection is being made. And this is a common issue. So across AI products and platforms, as you know, decisions, and it's a point of weakness, point of criticism that AI development is changing. Like, so how decisions are being made by algorithm, the lack of transparency, the lack of fairness. So this is something that we should consider when we evaluate the appropriateness of such tools. There's also a risk of automation bias. This is implicit in any AI platform, but in trial GPT and other tools like this, there's a very strong presence of automation bias. This is what bioethicists and other scholars, humanities scholars, are very concerned about. So how can we identify this bias, first of all, and then how we can address it? So epistemically, if there's a certainty about the bias inherent in automation, then how can we address it? And then there's the issue of that people who suffer exclusion, clinical participants who suffer exclusion through the lack of epistemic transparency, it will be very difficult to contest, to challenge such exclusions, simply because we don't really know how decisions are made on different levels when the tool is deployed in recruitment. So the second ethical challenge that is key is the issue of informed consent. So generative AI, as you know, is very powerful and very efficient in creating a variety of documents, and it has the potential to really make the process of generating personalized materials such as consent forms very quick. So here, there are concerns about how risk is being framed in these AI-generated personalized materials. So how risks are being described, like clinical risk, how they're being described to the participants, how they're how the studies in general are being defined and presented to potential participants. So the concern is mostly because streamlining the consent processes, ensuring that algorithmic representation of key risks is accurate, really lags. So this process really lags behind technology. So it is the technology is being used like for its efficiency, it's being deployed, but there's no scrutiny about personalized materials that are generated in this process, and then there's no scrutiny about ensuring that informed consent is truly meaningful and participants are meaningfully engaged to understand what are the risks they undertake by participating in any clinical study. So another ethical challenge, which is quite pronounced in the development of AI tools for clinical recruitment, is the algorithmic bias. So there is bias embedded in data sets. And this is not something new. So every scholar, every scientist, scholar, bioethicist who has worked in the field of precision medicine knows that, especially in the area of genomics, that genomic data sets exhibit strong biases. For example, genomic data exhibits strong bias towards Caucasian populations. Most of our large genomic data sets contain samples primarily from white Caucasian populations. So visible minorities, different ethnicities are still underrepresented. So it's a huge issue in the space of genomic medicine. So how do we develop personalized treatments there fully representative of the population diversity? So in terms of using AI tools for clinical participant recruitment, there's a risk of invisible exclusion. So given the lack of transparency in terms of how the algorithm operates, and even if it's not an intentional exclusion, the exclusion may happen on different level during the process, given that the data sets that we have are inherently, they're already biased. And of course, marginalized populations, visible minorities, people from low and middle income countries, they're most affected in this process. So the last challenge that I would like to discuss, it's about accountability. And I hinted about this problem in the beginning of the talk, given that we have a very strong qualitative shift currently from accountability, from human accountability, from a focused effort to ensure fairness and transparency. We have now moved to distributed responsibility across many actors. Some of them are not human, as you realize. So we cannot pinpoint human actors, institutions that are accountable for decision making. So we have very complex systems that shift and disperse this responsibility across different domains. And from a legal perspective, we have legal and bioethical perspective, we have unclear liability for harms inflicted on human participants in clinical trials. So this is something that needs to be addressed, and first of all, conceptual wise, but then addressed through governance and through regulation. And unfortunately, right now we have a very large governance gaps in terms of how algorithms are used in the clinical study process. And these are the four challenges, and it is a very so I provided a very high-level framing in terms of the major issues, but these are this is something really new to bioethicists. When we started our study, we were looking for scholarly literature, and there's very little. There's almost no studies that address this issue, simply because the technology is developing so quickly that ethical reflection is something that that doesn't keep up with the technological developments. So when we were thinking about responsible use of these tools that show such a great promise in terms of optimizing clinical trials and then indirectly for the fast development of biomedical treatments, we highlighted several conditions for responsible use and innovation in this field. And the human oversight is the first one, and it should remain key in this process. So when I mentioned that trial GPT is decision supporting tool at this point, I believe that this should remain the case with all other tools, that we should have human oversight exercised very rigorously over AI in these domains. Also, another condition is to really maintain dynamic informed consent process. So not just outsourcing documents creation to algorithms, but we should become more engaged in the process and ensure that the materials that are produced by automated systems, that they really reflect the clinical realities and the ethical challenges that participants encounter in the process. And also that risks, physical risks for participants are properly communicated, and that there is a good understanding by patients about what the consequences of their participations in clinical trials are. And so another major principle that we should incorporate into the development of such AI systems is the transparency and auditability. So I talked extensively about the probabilities involved in how the algorithms function, the lack of transparency in these tools. So this is something that is essential for the responsible use of AI across all domains, but in this domain particularly, given that clinical trials have very pronounced risks for human health. So transparent decision making, auditability of recruitment decisions. This is key. Not just in terms of protecting participants, but also as we strive to build public trust in the technology. So the final one is bias mitigation. This is a very complex issue, but it is important to really be aware about biases that are already embedded in the data sets we use, data sets we operate with. So synthetic patients, although this is in biomedical research, although this is anonymized data, it's still subject to significant bias. So we have to develop strategies to mitigate such biases. So key takeaways, I'm mindful of the time here. First of all, we need to be aware that AI recruitment, although it promises to make the process more efficient, to revolutionize clinical studies, it can also accelerate research. It can also deepen inequality in research. So there's the promise of accelerating research, but there's also the possibility of deepening inequity in biomedical research, as algorithms, again, are not value neutral. That is something that is very essential to understanding how artificial intelligence operates. Another key takeaway is the role of ethical foresight. Ethical foresight is a precondition for responsible and legitimate innovation. So as these tools are being developed, ethics should not lag. Ethics should actually goes hand in hand with the development of these new technologies. And finally, another important conclusion at this point is that ethical AI recruitment would require governance and public participation at all stages of development. So at the design stage, at the building stage for the technology, we need sustained ethical review. We need a stronger sensitivity to global inequalities. And some of the global implications, because this is the topic of the winter school, is about global bioethics and what are the challenges that a disruptive technology like AI presents in this domain. So we should be aware that ethical risks are not evenly distributed. Some populations, some segments of populations are at higher risk in terms of algorithmic bias and how, and whether they would receive access to clinical trials. So these issues become especially pressing in global trials and low resource settings, where data quality and regulatory capacity vary wildly. So I already mentioned about the globalization of clinical trial, and it's been ongoing for the past 20 years. And we should be aware that global inequalities are reproduced in this context. So it is a pressing issue to consider as far as global bioethics is concerned. So, and finally, and this is the concluding slide that I have. So the governance and the concluding slide is about the governance challenge in AI-enabled clinical recruitment. And I term this governance challenge because it is a policy issue. And when we develop these recruitment tools, like there's some fundamental questions that we need to address. And one that I consider particularly important is the following question: who is responsible for fairness, informed consent, and accountability when recruitment decisions are distributed across humans, algorithms, and institutions? So I take issue with the fact that we have this distributed accountability, and that is something that should be taken into consideration when we develop governance mechanisms for these novel tools in clinical research. So thank you for your attention. So I will stop sharing my screen at this point. And I hope that we can have some discussion, and I really would like to hear your perspectives, the perspectives that you bring coming from so many different countries, and bringing this unique understanding and opinion about how efficient AI could be in modernizing clinical trials. Thank you so much. Okay. Okay, did I disconnect the screen?
Yeah.
No, we can see you.
Okay. I'm sorry about the technical difficulties. I had prepared actually a PowerPoint which featured me in the corner of each slide, and I tested it on my computer and it worked out perfectly last night. Unfortunately, technical difficulties follow me today everywhere I go. So thank you for
don't worry.
patience.
Don't worry. It was very good. And thank you very much for your time. Yeah.
It was very good. I mean, it was very good, very clear, and the presentation was great. So, yeah.
Yeah.
Thank you. So any questions you might have, I should say that it is a topic that, has not been researched, and I recently started working on this. It's so new, and I'm just trying to wrap my head around some of the major issues and understand also how these AI tools operate, like purely on systemic level, because that can allow a bioethics scholar to really identify ethical concerns that may have been left unnoticed if you don't understand the systemic structure of these tools.
Yeah, indeed, AI is advancing very fast, and it's not more than 2 years, in fact, 2.5 years from the moment when people start speaking about AI in general, and we see it everywhere now. And yeah, amazing how fast compared with other technologies. Yeah, and very interesting your presentation.
Thank you so much. So any other questions? I don't see the chat if questions are being posted in the chat.
I'm Nadia from Morocco. I have a question. Not really a question, just a comment. When you explain about the informed consent generated by AI, like ChatGPT, I think the informed consent, even if it's generated by ChatGPT, the informed consent process which has to be made by the investigator, it's at least as important as the informed consent writing. And the process, normally in the process, you explain to the future patients or everything. You explain the risks, the right to withdraw, everything. I mean, I think the AI can be a very powerful tool, but as you said, if it's oversight by a human person.
Yeah, thank you for this comment. This is a very astute observation. Yes, you are absolutely right. It is right. It is a difficult process for participants to understand. So informed consent often requires the input of human actors, those being clinicians, family physicians, other health professionals. So it is, I think, problematic. You're absolutely right. It's problematic to rely simply on AI-generated documents. Also because I don't know what your experience is using ChatGPT. I use it very, very frequently and sometimes argue with it because it does make mistakes, a lot of mistakes. And then it's an incredible tool in terms of the analytical capabilities, but it does make mistakes. And then who actually provides oversight? And in terms of developing these documents and explaining the risks to patients, I think, clinicians, human actors is what really has gravity in this field, like what really can ensure participants that their judgment is right. So informed consent is a very difficult process. It's difficult for participants to understand the highly technical questions, the highly technical aspects sometimes. So they heavily rely on physicians to interpret the processes, the mechanisms involved in clinical trials. So can people trust AI that it would provide accurate information and will have their best interests? That's a tricky question, given that the algorithms make mistakes. And when I communicate with ChatGPT, I often prompt, because especially in my field, in bioethics, it does make significant mistakes. And then I prompt the algorithm to check different facts, and then it always admits that that's the case. But I mean, do I want to entrust my physical well-being to an AI? I don't at this point. I really don't.
Thank you.
Thank you. This was such a great comment.
Hello. Thank you for your talk. It was so informative. I want to ask about using AI in predicting, for example, cancer, feeding some tools, AI tools with big data, with for example, radiology reports, and then it will predict, for example, when the cancer will happen. What are the ethical challenges of this approach?
So like in cancer research, so predicting, you mean predicting the timeline or like projection of
Yes.
like how cancer will evolve and develop?
Yeah.
I mean, again, it's highly problematic, could be highly problematic ethically, especially if we consider the mental health being of patients, of cancer patients. As we know, algorithms could be wrong, and AI tends to be quite accurate in terms of analyzing big data sets and extracting patterns and developing probabilities. But dealing with real patients, it's something that I would say requires a strong relationship of trust between medical professionals and patients. And it's even more important in illnesses that are terminal, and cancer could be a terminal illness. So we need to proceed with caution, I would say, especially when we communicate projections and decisions by algorithms to patients. So I would say physicians still have a very important role to play in this process. So the physician-patient relationship is at the center, and is highly, highly important. So AI should be, and I am glad that trial GPT is, for the time being, just a decision support tool, not the final, not tool that makes the final determination in terms of diagnosis and treatment options. So that's my position on this issue.
Thank you.
Doesn't mean that it will AI will not develop in the future and generate more accurate predictions than humans. It is doing this already.
Yeah,
we can see in certain areas. But as bioethicists, we have to be aware how important the relationship between patients and medical professionals is. Like, this relationship is at the core, a relationship of trust, a relationship of care. So that's what I advocate.
thank you.
But yeah, that's a great question too. Thank you so much for asking.
Thank you.
Kalina, thank you very much for this interesting presentation. This is an extremely, important topic nowadays with this rising role of AI, artificial intelligence in medicine and clinical trials, and we will be definitely confronting a lot of ethical issues from now on. And I was just thinking about a comment, because you concluded with the question, who is responsible, or who should be responsible for the decisions in clinical trials. And definitely here accountability should be shared, and the final clinical decision must remain with humans. This would be like the investigator or the clinician, even if the AI system and this GPT or whatever it is provide some recommendation. And of course, we have this trial sponsor, that the company that should be accountable for trial design and justify when using AI tools and oversight and all this risk management and in monitoring and with compliance with this good clinical practice. But I still remain that the principal investigator should be responsible for these medical decisions at the participant level, how eligibility, for example, or the treatment, all these clinical actions, and maybe management of different side events or so. And of course, we should not forget about the ethics committees, the oversight. They have different names, and but they are responsible for the ethical approval. And of course, regulators and AI developers of these AI tools also, they are responsible, must be responsible for the technical performance and accuracy and I don't know, cybersecurity maybe. And so to conclude my comment, even if AI supports decision-making, it should not replace investigator and clinician, and this decision should lay at the level of a clinician, of a humans. Thank you so much.
Yeah, thank you. This was a wonderful summary of some of the major ethical considerations that I outlined in the talk, and your perspective is also great, and it's from this perspective that shows the importance of the medical system and the role of medical professionals in this process. So yes, you are absolutely right. Like, we cannot replace humans. We have to understand that in terms of matching, the matching possibilities. that the AI provides, it really exceeds human here, because there's so many different clinical studies in different locations. So it's hard for humans to navigate this process, and physician knowing how to refer them, where to refer their patients. So yes, AI is such a powerful tool, and we cannot, whether it will become indispensable in the process of matching participants in clinical studies, it remains to be seen in the future. My sense is that yes, it will, especially if we want to truly globalize this process and ensure access across many different sites that are geographically dispersed. But your comment was very good, saying that final decisions they have to rest with medical professionals in consultation with patients. And this is what I also advocate by highlighting the governance challenge as the major takeaway from this ethical reflection on trial GPT and similar tools. And like, please have in mind that this is a very new topic to me too. I'm trying to navigate this space and just figure out what are key ethical issues, how we can identify and address them. And I appreciate your input as well very much.
If I may add something, this topic is also relatively new for me. I started to conduct research on how Moldovan, because I am from Moldova, a country, so that is, just meeting all these technologies. And I was wondering how our physicians are using this AI soft and how they see that. It's remarkable that they see it they look at it with optimism. And although they do not have, official tools and I saw that would assist them in their work, but most of them, especially young generation, use the just ordinary ChatGPT version, maybe one and more advanced probably, but they see it useful sometimes because they look for the second opinion for some cases when. So of course they check everything, they do not rely on it totally, but it's kind of assistant for them in helping managing something. And I've been discussing with some head physicians, those who are responsible for managing the different the work of other physicians. They say that it is for them very important if I would replace the technical work that lays on the physicians, because they would like to focus more on a creative analytic activity rather than doing a lot of technical things. And then the I can help them with that. So they look forward to having something that would make their life easier and their job much more efficient. So that's just something. Also, I am very interested in this topic, so currently in it.
Yeah, this is a great point. It is very important because again, like there's like hundreds of thousands of clinical trials, and it's hard to navigate this space, and for a physician it must be very arduous. It's such an arduous task to find the best trial for your patient, the best clinical study. So in this sense, TAI algorithms are really indispensable because they can They have access to clinicaltrials.gov, so a lot of different databases across different countries. And, they also access data set of anonymized patient data. So it is this hard work that AI is doing for us. And it could be indispensable. The issue again for me is how we develop tools that are ethically responsible. So how can we overcome the ethical fault lines that are present currently in some of these tools? So yes, it is a process, and I think dialogue and debate and studies of bioethical issues is the first step. So that's why we started this research 4 or 5 months ago, and we hope to publish the study. I will share with if there's a list serve of the participants of the school. I will share the article when we publish it. But yeah, thank you for all this insight that you guys articulated. Yeah. Any other questions? You must be tired. This is the third talk since the beginning of the morning, right?
No, Kalina, yeah, you're very kind, very nice, and it's big effort for each speaker to prepare such talks. I know that. Now, this is our first day, so you were too harsh on yourself, saying that this technical issues. It was a kind of a warming up. The event, you know how it is, like singing opera. You need to warm up the voice. Okay, so we're learning actually. Yeah, if you don't warm up the voice, then goodbye. So the audience will leave the room. But especially when it is about singing opera. But it's the same with a course, right? But you've been so amazingly kind, I can say that again, to help me in all of this in enterprise, and also with the adventure of finding a guest speaker and so on, and being so again very, very helpful to me. And this talk, I think, is it's the first one on generative AI. We might have your friend, the guest speaker. I think he's going to refer to that too. The global, the Samuel.
Oh, Sam. Yeah, Sam. Yeah. Oh, I haven't looked at his. He was my colleague at the University of McMaster, and then was a research fellow at our institute. So now he's with the Canadian Institutes for Health Research. He's a senior research ethics advisor there, working on global bioethics and global health. So
but you know what? Yeah, sorry. What I wanted to say, this is straightforward on research ethics. So I have not listened to too many lectures related to AI, the AI role in research ethics, and especially clinical trials. So it's becoming more and more interesting, I'm sure, and it can be a topic for the whole school. I mean, the whole conference. My question is, have you attended any recent conference on AI and clinical trials? I mean,
No.
Yeah.
You're right. You're absolutely right. It's a very new topic. There's literally nothing published on the ethics of generative AI in clinical trials, specifically for recruitment. So Renan and I are working on this paper, and we heard that there's a group at Stanford University that's working on this as well. But
in Canada?
No, at Stanford in the United States. In Stanford
University. Okay.
Yeah, they are working on this topic as well, because we also started analyzing it, but it's such a great area. So yes, when you guys evaluate my talk, have in mind that it's really like the wild west. So it's probably, if it was on a different issue, it would have like flown like in a better way. But this one, I had to think a lot about it, and I haven't really heard about the conference where this particular issue is being discussed. I got an invite the other day. There will be a conference in Calgary to talk about AI and knowledge translation in the context of antimicrobial resistance. So there is interest in just generally using generative AI specifically for knowledge translation. But in terms of and you can see the industry is so proactive, because like it is a highly highly structural issue, participant recruitment, like across different so companies, global pharmaceutical companies that operate multiple clinical study sites, and just access to a larger pool of participants, like through synthetic patient data, that would be revolutionizing the process. But again, it's I really appreciate the invite. I really appreciate the opportunity to just share some thoughts on this issue, because it's a very, very new topic for the bioethical community. And I was really happy to hear some perspectives from the participants that kind of resonated with my thinking. So Victoria and everyone else that commented, thank you so much. So at least I know I'm on the right track with this study. But again,
an idea, because you came with this topic, maybe we can collaborate and develop a conference. I always wanted to hook up to such program, a 2-day conference, but it's a lot of work. So I need help with that, And I know people in research ethics, a couple of them, but my friend from Oxford University, who is an expert in that, and we did a school together in Bangkok. So the most beautiful, actually, the last one. And then we moved online. But Pekyang Chia, she didn't want to have a talk about AI in clinical trials. Like you, she said this is more to develop.
Yeah.
And she's straight for the clinical trial. So let's see what is going on in a very near future. And maybe we can do this. I want to have more speakers about this, because that's very important. So this is...
It was a little bit risky. I was like, I don't know if I have enough substantive, I can present enough substantive analysis from a bioethical standpoint. But it is important to initiate the conversation, because Trial GPT has matured as a tool. It will be integrated fairly quickly in the months to come, especially with the approval from the National Institutes of Health, NIH in the United States, and so that's what I hear from my collaborator, that it's becoming really institutionalized, the use, and and validated by policymakers in the United States. So it's a good time to initiate the conversation.
Yeah. I'm curious about now. And everybody started. Adarsh Srivastava is a relatively new friend. He's working for Rush, and I think he's touching this in his talk. He's a very smart guy. So we learn which kind of questions we should ask him. So let's see. Yeah, maybe Rush will pay. Maybe Rush will co-sponsor such a conference. That would be a great. You see.
I will make sure I attend his talk. I will definitely attend his talk.
If you want, he's actually very good. He's an engineer, a smart fellow, and he's going all over. Well, he commutes to Geneva somehow, because that's where, Roche, right?
No, I don't. Just by name.
It's a big pharma company, and it's headquartered in Geneva.
But you mean the company? Oh, not the speaker. Sorry. Yes, the company. Yes, of course.
You know that. They're very rich. They're very big. But we will see if we can get closer. We need to write the proposal. We need to, but maybe because you're so good, maybe I can do this. Maybe we can do this together. Don't you think? I'm good in organizing.
Sounds like a good plan. And again, thanks to all the participants. And I do encourage you to look on our website, genomicsandSociety.com. The Bioethics blog accepts submissions. I haven't written a formal call, but usually it's by invite only. But it is an opportunity if you want to share your thoughts on
we would like to
topic. Yes. Doesn't have to be about ChatGPT, trial GPT and clinical trials. Could be on any of the topics throughout the winter school. If you would like to write a short blog, I'll be happy to support and edit it and publish it and give you some visibility because I love working with younger people and any trainees, anyone who's interested in learning more about bioethics.
And hey, they're from all over the world.
And especially people, that bring very unique, very diverse perspectives on the clinical practice, because there are cross-cultural differences that are fascinating between, different countries. Even, if you look at the European Union, I'm originally from Bulgaria, but I have been living in Canada forever. But if you look even to this culturally very similar, very coherent environment between different countries, the institutional context for the medicine are so different. So yes, I invite you to take a look. If you would like, get in touch with me. You have my email. If you want to publish a reflection, even if it's just a reflection on your experience at the bioethics winter school, how different talks inspired you, what were the major topics that caught your interest. If you want to publish a blog post on this, I'm happy to facilitate the process. And the Bioethics blog of Genomics 4S, this is the abbreviated name of my institute, it will be happy to accept the submissions.
Perfect.